All right, so coming to the stages of training, what are the kind of things that you're going to come across? There's a lot of information on the RANZCP website, so I'm not going to necessarily talk about the details of the curriculum and all of that, because that's easily accessible. But what are the things behind it that one needs to be aware of? You've got stage 1 of training, which the college has divided into basic, proficient, and advanced, and they talk about entrustable professional activities. So these are, I guess, a range of skill sets that you will be developing over time that will essentially help you later in your clinical practice as a consultant psychiatrist. It is highly likely that many of you at some point will enter private practice, and private practice is a completely different ballgame. It really is, and to be quite honest, as a trainee, and I can speak from experience, and I'm sure you have the experience as well, we get very, very little training to equip oneself for private practice in the future. So as a result of that, what happens is there's a lot of hesitation in actually entering private practice, when actually that's a great part of psychiatry, because I see patients from the age group of 14 to 80. I do alcohol addiction as well in private hospital. I do reports, civil reports. So there's such a breadth of experience and lots of stimulation that you can actually get in private practice. So actually I did a bit of private public, so mixing both of that can give you a lot of satisfaction as well. And I guess all of this is to help you at some point transition into private practice easily, because that's where these skills become really, really useful. What happens when we're working in hospitals is the majority of the patients tend to be along the psychotic spectrum. And one of my colleagues often says that registrars are used to working in the trenches of psychosis. And what happens is in the exam, when they're tested on questions with regards to anxiety disorders or somatoform disorders or certain clinical governance aspects, they'll find it extremely difficult. And that's because they're not used to necessarily thinking along those lines, because they're not exposed to that. So essentially the aim is to start thinking about it right from the beginning, because it's those small thoughts that will add up to make you a complete psychiatrist down the track. So in your 6-month rotation, you would be expected to complete 2 entrustable professional activities. Stage 2 is your complete written psychotherapy case, 3 out of 4 psychotherapy EPAs, the scholarly project, and the MCQ exam. So that's the first step that most people will take, is the MCQ exam. Now I'll give you a few tips about thinking about the scholarly project, which is going to be either your audit, a clinical research project, or a case report. I'll come to that in a sec. Stage 3, you've got the MEQ and the essay, and this is, I think, an important thing to keep in mind. Recently I got an email from someone who said, I've passed the EMQs, I attend the course and I'm really excited, I'm really happy, I'm feeling confident, I want to give the MEQ as soon as possible. Now, there's no reason not to do it, but what's important to be aware of is that MEQ is a very, very clinically focused exam. So the questions that you receive, that you come across in the modified essay question exam are things like a patient has committed suicide on the ward. List the individuals that you would contact, for example. They would give you an ethical dilemma. And these are some of the things that we're not often used to, or registrars might not be used to thinking on a day-to-day basis. So I'll show you some examples of questions that can come across. Another question might be, you have a patient who's told you that his brother is a GP and has been prescribing dexamphetamine for him for the last 5 years. How would you approach this? So those are the kind of questions. So it's not about how do you manage ADHD. It's about, there's an issue here, there's no right and wrong answer, but do I have a structure to approach this taking into account all the principles, clinical governance, risk management, etc. That's what the modified essay question is about. So the college recommends that you do it at a stage when you've completed your specialty training, at least having worked in different settings. Okay, so it's a very, very important point to keep in mind. The essay, I will talk about it in a bit more detail, but essay is really breadth of experience, and it's not just your clinical experience. It's about, you know, knowing what's happening in the political sphere, for example, what's happening socially, cultural aspects. You bring your own clinical or cultural experience within it, but it's about integrating all of these things within the essay. So recently a candidate told me that they did not get through, but the feedback that was given was the essay, the structure was okay, but the content was narrow. And if you look at the essay marking scheme, which is available on the website, they talk about breadth. So it's really important that your themes of the essays are actually diverse. So that's an important point to keep in mind. And you can see why knowing this now will help you down the track, because if you start thinking about things, you know, what's happening with mental health with regards to the budget? How will that affect mental health? How will that affect training? How will that affect patients? So these are some of the things when you watch television or when you hear Joe Hockey talking. You know, you can think about, oh, well, how might this impact mental health as a whole? How might changes to the GP investment or budget impact on mental health? So these are some of the things to constantly think about as you go along. The next bit is your OSCE, which is the Objective Structured Clinical Examination. And bear in mind that the MEQ and essay, the MCQ exam, the OSCE, now with the 2012 curriculum is marked at a consultant psychiatrist level. So it's not at the advanced training level. So the questions are going to be a bit challenging because you're expected, it's an exit exam in a way. So that level of thinking does need to be at the level of a consultant psychiatrist. And I'll provide some tips on that. So with regards to your scholarly project and your review, case series and audit, what I would suggest is, because some of those things you can start doing already. Writing a case report or writing a case series is something you can start putting in place right from the beginning, because you will be seeing cases that can be written as case reports. You know, for example, during my initial stages, I had written a case series of lithium and hypoparathyroidism, for example. You know, 2 cases, but what happens is you write up the cases, you then do a literature review, and you integrate that, and you come up with a case series. That's your scholarly project done. The other option is you can speak to academics within your setting and say, I would like to be involved, and they can pass on some of that work to you. And that would involve either reviewing a certain part of the article, sort of reviewing and writing it up, or some other tasks. But speaking to an academic at this stage can really help. So have a think about that from now, rather than saying, well, I've completed everything, oh, now I've got to do the scholarly project. That's a lot more difficult because you're sort of under pressure to think about something. Audit, I'll give you an example. So in the MRC site, one had to do an audit as well in order to progress. So my audit was a simple question that I asked was, is the completion of risk assessment within the old age psychiatry setting where I was working, is that adequate? So the first, and that's what the audit is. You ask a question saying, I want to look at how risk assessment is being done here. I set the gold standard. So my gold standard was 70% of risk assessment should be completed on admission within 24 hours, and on discharge, for example, within 24 hours. So this was my benchmark, but that doesn't necessarily mean, you know, that's it. You can choose your own benchmark. And I then took a random 100 notes, and I went through each one, and I found that, you know, what was the percentage that actually fulfilled that particular benchmark. I then, if it was below benchmark, I then came up with recommendations to improve that, and that was the audit, and that was what I presented, and that's your scholarly project. Okay, so it's a simple question. You can look at things like diazepam prescription on the ward. You can look at Accuphase prescription. You know, so your question is Accuphase prescription excessive? You can look at seclusion. You know, there's all sorts of questions. These questions come up all the time, you know, in ward settings or clinical settings, case conferences, etc. So when you have questions that come up, have a think about whether that is something you can do. The other really easy thing to do is have a think about a question that is linked to pathology. Very easy to gather data. So have a think about, you know, what is the proportion of patients that might have an X abnormality, for example. You know, but bear in mind, certain audits may require, especially if you're looking at patient intervention, they may require application to an ethics committee. So always discuss it with your consultant, with the other, or with the academics in your setting. So the key point here is please start thinking about this aspect already. Stage 3 as well. Start thinking about it in advance, okay? Because staying with that thought for a while actually increases familiarity, and therefore you're less anxious about approaching it as well, okay? Because sometimes, you know, you stay with a thought for 6 months and everything just seems that it's falling into place and I'm ready to do it now. I guess the nerve-wracking bit is when you've not thought about it and say, oh, you know, I've got to do the exam now. That's when it's really, really nerve-wracking. The same thing when we come to critical analysis, there's a tip there that you've got to keep in mind.